are those numbers going to look like? Do you know what that's going to result in for ICU? You've talked about modelling through this week. Do you have it now? Can you share it with us?
Look, the modelling, excuse me, differ every day. Different variables are put into the model. So what we'll do next week is provide you the information we have at that time. But that's dependent on the fact that everybody does the right thing and they follow the settings. So we're pleased to provide that information next week in conjunction with our plans for how we've quadrupled our ventilators, how we've increased our ICU capacity and what the plans are in place to make sure everybody has the degree of confidence I have that our system's been working at it for 18 months. But I just want to make very clear that every day there are models that are presented from within the experts we have in New South Wales, but also externally from non-government organisations. And nobody is going to get the exact figure right, nobody's going to get the exact day right. But I've been very open with the information I have, and the best information I have is the worst number of cases is likely to occur in the next fortnight, because after that time, the number of vaccinations we've put into the community, especially in those local government areas of concern, will start having effect. And that's when we'll start to see case numbers go down. Having said that, though, we know there's a lag with the number of people who then will need hospitalisation. The experts advise, as we've done often, that serious illness tends to develop in the second week of infection. So given where the case numbers are and given that lag in time, we're anticipating October to be the worst month for our hospital system. But having said that, every day that goes by, we're seeing more and more of our population vaccinated, and that's the biggest weapon we have. And that's why I've said that the numbers that we need to look at very closely are obviously the vaccination rate, especially in our vulnerable communities, and then secondly, our ICU capacity and the number of people in our ICU system. And we will present that information next week, but I do qualify that by saying it changes on a daily basis depending on a number of variables. And one of the variables, which none of us can predict, is everybody doing the right thing. And unfortunately, in the number of circumstances that we get information on a daily basis, more often than not, everybody doing the right thing, getting vaccinated, staying home, following the health orders, in the main is safe. It's when others, a small number of people do the wrong thing. But having said that, we also know that Delta is horrible in terms of not presenting symptoms until a few days into the infection. So even people who are doing the right thing are caught unawares, and that's why we're just asking people, especially in the next fortnight, as we've done every day, to assume every time you leave the house. That goes for all of us. It doesn't matter what your postcode is. It doesn't matter what your circumstances are. Every time any of us leave the house, we need to assume we have the virus, and that's how we should treat people we're in contact with. So even with a mask, you need to have good social distancing. Even with a mask, you need to make sure you're following all the health orders, because we cannot be complacent. But what we do know works, and I know I don't mean to be glib when I say this, but in a few months' time we'll look back and realise that how worse the situation could have been in New South Wales. And I just want to commend all of our health workers, both on the front line but also our contact tracers. Every day they talk to people with the virus, they talk to their families and loved ones. They give us that information we need to present to you to make sure we're keeping everybody safe. So it's a complex system, and our systems in New South Wales are holding up incredibly well. But having said that, we know that, as I've always said, September and October will be the most challenging, because we'll be going through the phase of dealing with extra hospitalisations and extra ICU hospitalisations, but we'll also be going through both the exciting but challenging time of opening up. So those two things will be happening at the same time, roughly, but that is shouldn't be a concern, because we, as I think time will tell, every decision we make in New South Wales on behalf of our people is based on the best advice, is based on what is going to keep everybody safe, but also what is going to relieve our citizens of the burden of lockdown. And I'm looking forward to those opportunities.